GLP-1 skin and hair. Everyone's like, oh, they look gaunt, they look so much older. There's like Ozempic rumors about them, right? And what do we do to the skin, and what does happen to the skin when patients are on GLP-1 medications?
Hello. I am here today with the beautiful Dr. Tess Mauricio. She's a board certified dermatologist, very well known for her regenerative therapy for aesthetic. And today, we're gonna talk with Dr. Tess on what is she gonna her specialty, and also what is she going to teach us at San Diego Art Show. Welcome, Dr. Tess.
Hi, Anne. How are you? Thanks for having me.
Oh, it's a pleasure. It's a pleasure. And I've always loved to talk with you and your husband. Not a lot of people know the stellar faculty that will be teaching at San Diego Arts until you're actually there. And that's one of the reasons why we want to highlight the podcast is to let people know the expert that will be teaching. So, Dr. Tess, tell us about a little bit about yourself and what's your area of expertise.
Yes, so I am a dermatologist, and I was an early, I guess, player in the regenerative medicine world. And how I got involved there is I'm one of the few dermatologists that actually was trained in liposuction. And so when the concept that fat has biologic properties, it has, stem cell properties, I kind of got in that lane pretty quickly. And our philosophy at M Beauty Clinic has always been the natural approach to reversing aging of the skin. And it was actually one of the first dermatologists that introduced the concept of combining energy based treatments that we use all the time as dermatologists, lasers, microneedling, dermabrasion, with the regenerative products. At the time when we introduced our time machine procedure 15 years ago, it was only platelet rich plasma was being introduced. And so we started creating these protocols combining energy based treatments with platelet rich plasma. And what we found, and which was amazing, and we've done like half face treatments when we do just laser alone versus that combination, what I call regenerative stack, is that one, we decrease downtime, we immediately decrease that burning sensation. And in skin of color, especially, it would decrease their potential for post inflammatory hyperpigmentation. And then the results were better. And so that concept, then, when we started working with nanofat, we took our regenerative stack, a step further, and then we introduced nanofat in the mix. And, it's been amazing. And we started introducing it not just for skin, but also for hair and intimate wellness.
Okay, so tell us about the regenerative stack. What is that, and how does that work?
When you think about aging, we don't really, age linearly, right? So there are many things that are happening, right? There's the structural support you lose. There's decrease in collagen formation. There's the vascular issue. There's inflammation. And so when you look at it and not just like address it mostly like with fillers or maybe neuromodulators, you really look at and address what's happening, the biology of the skin, and you truly are regenerating, you're repairing, and you truly are reversing the aging of the skin. And so that's really an incredible concept that was new at the time. I think now it's a little bit more well established, but that's the concept of regeneration, utilizing and activating our natural ability to heal, repair, regenerate. And we know that we can do this, and we now have more tools than ever. And the conference that we will be speaking and teaching, the San Diego Academy of Regenerative Therapies, SDART, there will be pioneers of regenerative medicine, just kind of pushing the envelope and just getting incredible power outcomes.
I know, and you are definitely the pioneer in doing regenerative, combining with energy. Now, why add fat? What does fat do to the regenerative stack? So we know about PRP, which are the platelets. What is fat? What does fat do to bring it to the next level?
That's a great question, and especially now where, GLP-1 is just everywhere. We're seeing this, and of course the target there is people want to, lose weight. And we now know that adipose and fat is not just there for cushioning. It's not just there for support or volumization. It is a biologically active cell. We know that there are stem cell properties. We know there's growth factors and exosomes, and adipose and fat is really part of the cell to cell communication to really cause regeneration. So it's a lot more complicated than we thought in the beginning, because we would suck out fat, throw it away, and then we realized that these cells actually are so rich in our own regenerative stem cells that we can now use it for that property, to really try to reverse the aging of the skin, to repair it and to regenerate. And so what we do in our clinic for those patients who want to utilize their own nanofat stem cells is that we will harvest just under local anesthesia. And we just did this for a patient yesterday. And then we will size it down, and then we will do all of the energy treatments that we will do specifically customized for that patient, depending on their problem, if they're worried about wrinkles, scars, sun damage, depending on their skin type. If their skin of color, we may use different energy. But then we will use nanofat. We can either inject that in areas where I want to naturally volumize. Everybody, what they do is I would actually administer it topically after the energy, whether that's laser, RF microneedling, and then we follow it with PRP and also exosomes and PDRN. So it's all done in one visit, and patients get power outcomes with these types of combo treatments.
Gotcha. Now, what will you be talking about at SD Arts then?
So of course we're going to talk about, the combination, but specifically this year, what's very interesting is that, GLP-1 skin and hair, and
Hmm.
how this has really truly affected the patient population, and how now this is a completely unique cosmetic patient, because as we talked about,
Mhm.
right, fat is a bio has biologic action and activity. And what do we do to the skin, and what does happen to the skin when patients are on GLP-1 medications? And we see this all the time now with Hollywood stars, right? It's like when everyone's like, oh, they look gaunt, they look so much older, their skin is sagging. There's like Ozempic rumors about them, right? And so there's new studies now that are out, and I'm going to share the studies about GLP-1 and how it affects the skin, and also how it can affect our treatment results and the response to treatment, because we are now working on skin that's been altered biologically and metabolically.
Wow. Wow. So just give us a little tidbit. So the GLP make the skin worse, and that doing the regenerative stack will kind of put more cushion in the kind of like the fat that they lose from the GLP-1.
What we find is that, GLP-1s will affect obviously the volume, though there will be volume loss, but in addition it also affects the vascularity of the skin, and also the cellular cell to cell communication. And so absolutely, you're right on, Anne, and that when we have to treat the patient now biologically, so fillers are no longer enough. And that's why when patients come
Mm,
to us and they've had fillers, and even the bioregenerative fillers like Sculptra or Radiesse, it doesn't look as good. The skin does not have that healthy glow. And so we got
mm,
to address it. We have to restore the vascular support. We have to restore cell to cell communication, and now more than ever, our biological regenerative stack makes sense for the GLP-1 patients. And then also, I think educating our patients, and to do that, we got to educate our fellow, you know, doctors that it's really just beyond losing the cushioning of the skin. It's truly changing the biology and the metabolism of the tissue itself.
Wow, that is pioneering work, honestly,
Thanks,
because
man.
yes, yes, no, that
60 million
I
people now are on GLP-1, and going to be, probably the most popular drug that's going ever invented.
mhm.
And Amazon is looking to, dispense
Oh,
GLP-1s. And so in our world, these are the type of patients that we're seeing. Obviously, it's game changing for those who have metabolic syndrome, diabetes, but a lot of people are using this more, around perimenopause, menopause, to lose like the 10 to 20 pounds, or even some practitioners are saying that it could be a longevity medication. So just something to think about. And I think SDRs is a great place to have this kind of dialogue.
absolutely, and really pick the brain of Dr. Tess, who is really pioneering the work on restoring the youthful look after GLP-1 weight loss medication. And I have several friends that did GLP-1 and their face was gaunt. It looked it didn't look well. It didn't look right.
Yes, and that's
Uh,
right. It's like it's not, we can tell when someone looks healthy and vibrant.
mhm.
And that is what's really lost for a lot of people. And that's why people are panicking. Patients on GLP-1 are panicking, and educating. What we know now is that if we address it and create a plan, especially for those who really have to be on the medications for medical purposes, creating a plan ahead of time, anticipating the biological and metabolic changes that are going to happen. And it's not just on the face, it's full body, and it even affects the hair. And so that's definitely something that can be planned, and there has to be a partnership, with a practice who really understands the regenerative things that are happening to the skin and hair.
Wow, wow. So that's awesome. So, you've been a faculty with San Diego Art for a long
From the
time.
beginning, yes.
Yeah. So how many years now?
I think is this their sixth or seventh year? So however many years, I was
Uh-huh.
honored to be there from the beginning. And like you said, it's kind of underrated because it's mind blowing who are the faculty that you get to meet in a very intimate setting, right? When you talk about nanofat and the regenerative properties of nanofat, Dr. Trinard and Verpey and Dr. Bob Alexander, who are really the guys, the gods in this field, are there. And pioneers in hair restoration using nanofat, and intimate wellness like you. And so I think it's people have to know, if you are considering adding regenerative therapies in your practice, whatever field you're in, this really is the conference to go to. And to add to that, it's going to be in San Diego, my hometown, at Torrey Pines, which is, you're there by the Pacific Ocean. Beautiful weather. Just for the vacay alone, you should come. But the types of dialogues, discussions, and cutting edge, therapies that you will learn about, it's really amazing.
Absolutely. So, what set San Diego Art apart from other regenerative conference?
I think that here, like I said, you have the true pioneers, of the field, and also a lot of people who are kind of going. They're not just in one lane, right? So yes, I'm a dermatologist, but I harvest nanofat. I treat patients for their hair and intimate wellness. So I think the fact that we can interface and get the perspective of plastic surgeons on the same problem, to a regenerative medicine doctor, to a scientist, their perspective on the problem, I think is very, very special because it's multi-specialty. And also, like I said, these are the doctors who are pushing the envelope, and so you can learn about what they're doing that they think is working, and also you can learn about things that maybe not working so well, or didn't work so well, so you don't waste your time.
Absolutely, and that's what I found. In fact, I was not with San Diego Arts in the beginning, and my first event was last year. But I've been going to a lot of regenerative conference for at least the last 10 years, or even 12 years since I started doing regenerative therapy, and it struck me that San Diego Art is different. It's different in the way that how it's organized, the high level the faculty that is there, but also what is the chance to network and ask these faculty who are
Yes.
world famous, who really define regenerative medicine when before there was regenerative medicine, right? Who really was the first to use fat, when we thought fat when you should throw away fat. So
Mhm.
I was blown away from that, because most of the time when we go to conferences, you see faculty speak and then they disappear, and you never get a chance to
Yes.
get even talk to them or ask questions like that. But at San Diego Art,
You
you
become
get a chance to do
friends.
that. Yeah. Well,
Like
that's how
we
I
had
get to
so
know
much
you.
fun. Exactly, we had so much fun, and really that's what it is. Is a very collegial, and like I said, it's an intimate setting, especially for now. But I think that when people find out, it's probably going to get bigger, and so really take advantage of the fact that you do have that opportunity, to interface in that intimate setting. They'll really tell you what's going on, and fun, and you can't beat San Diego as a location. This is why I live here. So
That's right. I love San Diego. It's in the 70s all year long. So,
yeah.
two questions. Two questions. So, what have you learned in all the years that you've been attending San Diego Art? What have you learned clinically that you have applied to your office?
One of the things is, of course, I work with hair, and so some of my colleagues, like Dr. Ryan Welter, has have introduced incredible hair protocols.
Mm.
Dr. John Cole as well, incredible hair protocols, combining nanofat, and even different ways to approach, um, kind of a hair loss patients, which dermatologists were supposed to be experts in hair as well. And like I told you, with GLP-1 issues now and hair loss, and telogen effluvium, we're really trying to find the best. So I think that's one area. And then, trying to just talk to Dr. Bob Alexander on like the geeky side of things, which is kind of the science part. And I truly enjoy that a lot.
Yeah, he was the one that taught me how to harvest fat for pain indication using tulip. And that was
Mhm.
the first time I've ever harvested fat. And I'll tell you this: I came to his office and learned how to do this, and he made me do all the work the whole day. I was like, he said, "You're so good that I let you do
Just keep
most of it."
going.
And
Just keep going, man.
he just walked out of
Pros
the
and
room, and
cons. Pros and cons
I'm
of
doing
being
all the
good.
work. He said,
But you got a
he
lot
just
of
left the room.
practice.
I
Yes.
know. And I'm
No,
like,
no,
am I supposed
totally.
to do this?
Doctors did tell lead too. I mean, the use of nanofat for peripheral nerve injuries, right? I mean, I don't do it, but it's good to just know that these types of treatments are available, because
Mm,
sometimes you come across patients where you think they've tried everything, and patients with intense, intractable, what people think is untreatable migraine, pain, headache. Dr. Ziv Peled has an incredible way to do that. And so like I said, these are just like really pioneering, cutting edge doctors, and then of course the plastic surgeons, the Instagram, famous plastic surgeons are going to be there, right? Dr. Mani, Dr. Gavami, and so you get their perspective too. And then there's the cadaver lab is incredible. So I always encourage people to try to get in the cadaver labs, because you are right there and they're showing you exactly, and then you get to try it.
You're doing regenerative medicine right now, or if you want to learn regenerative medicine and you want to learn from the best in skin and hair, Dr. Tess will be there at the cadaver lab showing you how what her protocol is, and you get to pick her brain as well too. And so I think it's the best venue conference to go to if you want to learn how to do that. But what one more question is that if when someone at the conference there's the first time coming, what question should they come and ask you?
Maybe ask me about specific problems, specific type of skin, and then we'll talk about what energies I would use and what regenerative products we're going to stack.
Thank you for being with us today and highlighting your expertise and just getting to know you
Yes.
better. And and that was our whole point, is to show our talented faculty, and then also that what a cool person they are also.
For sure. Thank you, Anne, and thank you for all you're doing to really, spread the word and improving. Our goal always, obviously, is to really improve our patients' quality of life. And now more than ever, especially with regenerative medicine, regenerative aesthetics protocols that you learn at SDR, you really will be able to do that, and in a natural way and healthy way, and truly addressing what's happening biologically.
Absolutely, and especially if you want to know about skin and hair, which is very very specialized as well. I'm always interested. In fact, I'm listening to you. I'm saying, oh, maybe I should go see her.
No, see, you wouldn't be the first. You wouldn't be the first of one of my, faculty friends. I'm always honored to take care of my, dear friends, of course. And we have patients who travel from everywhere because we can do so much in a single visit. You can fly the next day. You'll be a little, swollen, whatever, but you can still fly the next day, but spend a few days in San Diego. It's perfect.
Absolutely, yeah. I may
Maybe when
see
you
you
come,
more.
you do have a few extra days, you told me.
I
Sounds like we have a
know.
plan, Anne. Time machine for Anne.
Oh, I know. You know what? We're women. Anything about making us look
And it's all
youthful
natural. That's the
and
key. You never, with these regenerative treatments like the time machine procedure, the patients specifically come to me, Anne, because they don't want to look different. They don't want to look like someone who had work done. And they want to naturally reverse and reset the aging of the skin. And we are able to do that now. This is how I maintain myself, my skin and my hair. I'll be 55 in November.
oh my
And
god.
this is how I maintain my skin. And you know and that's why I'm so passionate about the regenerative aesthetic space. From my own personal experience, I've had nano fat and everything we talked about, all of that. I've had that done, and it works.
And well, you can tell she looks like she's in her 30s.
Thank
And she's not only beautiful on the outside, but also very beautiful on the inside. And I have a chance to
thank
meet
you.
her and her husband last year. And so that's what makes stand out about San Diego Art to me, is to be able to connect with the speakers, the faculty, and just even the attendees as well too. So if you're looking for a regenerative conference that is unique, where you get to connect with the faculty on friendship basis and also to ask them questions, you feel like the organizer really care about their attendees
100%.
and their speakers, and it shows. doctors, if you're listening to this, check out San Diego Art. It's going to be in Torrey Pines, San Diego. Dr. Tess and I will see you
See you
in San
there.
Diego.